So you've been diagnosed with palpitations in the emergency room. Here's what you need to know and a bit of what you might like to know. So palpitations are actually quite common, and there's many different causes for palpitations. We often don't know in the emergency room unless we happen to see what's going on the monitor while you were being monitored in the emergency room. Sometimes patients show what they're doing, and other times nothing happens while they're sitting in front of us. Most commonly, they're caused by PACs, or premature atrial contractions. These are the top two chambers of the heart. Your heart's made up of 4 chambers. The top 2 chambers of the heart are having an extra beat every now and then. This is not harmful. I, in fact, suffer from them, particularly if I drink too much coffee, and I feel an extra beat every now and then, and I've seen it on a monitor that it's a PAC, or premature atrial contraction, so I am not worried about it. I just try and avoid caffeine. Number 1, I try and avoid getting stressed, because stress can bring on the palpitations. And there are certain other things that can also bring on palpitations, like illegal drugs, cocaine, methamphetamines. I always ask patients if they've been taking any of those. And certain other drugs like weight loss pills, thyroid pills, and a few others can also cause them, like asthma inhalers can make your heart beat fast, and they can exacerbate any underlying premature atrial contractions. But again, those are not harmful. The other most common cause is premature ventricular contractions, or PVCs. Again, these are not harmful either, except in the single setting when the patient is having a heart attack. Otherwise, many people walk around all the time and have PVCs. These are extra beats that are not coming from the top 2 chambers of the heart, they're coming from the bottom 2 chambers of the heart. Again, we don't worry about these unless the patient is having a heart attack at the same time. Many patients want to know why they're having these extra beats when they didn't have them before, and perhaps they're not drinking any more caffeine than usual. And I liken it to when you have a twitch in your eyelid, and for a few days that eyelid just keeps twitching, and it's an extra cell in your eyelid that's firing and making it go, and it just needs some time for that nerve to die off and to relax. Same thing in your heart. You may have an extra cell that's just a little bit irritable, and it's firing a few extra beats every now and then, and it may need a few days or so to come back to normal and stop firing. Sometimes, and in fact more often than not, we can't find a cause for the palpitations, so we need you to follow up with your family doctor. In fact, we usually do send you to your family doctor, and the family doctor will schedule 2 tests for you. Number 1 is called a Holter monitor. This is like a big computer that you wear on your neck, like a really big necklace, and you wear it for a couple of days, usually 1 to 2 days, and it will monitor your heart the entire time to see if we can catch one of those extra beats and figure out what exactly it is that's causing your palpitations. It's very helpful if we catch it, although most of the time, about 20% of the time, we can find the source, and 80% of the time we don't. But it is helpful if you can get one of those through your family doctor. It's called a Holter monitor. The other test we like to see done is an echocardiogram, or an echo for short. And that's an ultrasound done of your heart, just like when a woman is pregnant and we do an ultrasound of the baby. This is an ultrasound of your heart to see what your heart's doing to help us determine the cause of these palpitations that you're having. So those are 2 tests that you can get with your family doctor, a Holter monitor and an echocardiogram, and they can be very helpful to figure out the source of your palpitations. Again, you should try and eliminate any causes for your palpitations, like caffeine, illegal drugs, obviously, stress. If you have an increased baseline level of stress, maybe your job is stressful, you're moving, getting married, it's a good stress, a positive stress, but it's still a stress. You want to try and decrease your stress or manage your stress better if you're getting palpitations. And when I say avoid caffeine, not just coffee, also tea, colas, even chocolate has quite a bit of caffeine in it, so try and cut back and see if that helps. Reasons to return to the emergency room would be if you're getting episodes of palpitations that are ongoing and not going away, particularly if you didn't have that in the emergency room before and we didn't see them on the monitor, or more importantly, if you develop any chest pain, you need to come back to the emergency room with that to get further investigated to make sure you're not having a heart attack, shortness of breath, or feeling lightheaded with your palpitations. Those are reasons to come back to the emergency room. Otherwise, follow up with your family doctor to get those tests that I talked about. I'm Dr. Atzema, and those are my discharge instructions for palpitations.